Hello. Wanted to provide this short video update for this week, as opposed to a traditional, regular announcement, text-based announcement. Just trying to remind folks that lesson 2 is due this week. This lesson talks about interactions between medication and psychotropic drugs. This is really one of the main issues that we don't give enough thought to in terms of society and working with clients, that any medication generally has some type of side effect that is not acknowledged, or is not acknowledged, or is not apparent, or maybe it is, or so forth. But generally speaking, the stronger the drug, and the more serious in terms of how the drug is used to treat a certain mental health issue or physical issue, the more likelihood of significant side effects happening. With my client work, I can remember multiple clients that were taking significant amounts of psychotropic medication that was causing massive side effects that resulted in them taking more medication to counteract the side effects from the first medication, and you kind of had this revolving circle of unintentional side effects. And sometimes these side effects were much more worse than those of the actual disability. For instance, I had one friend who was a psychologist that found out he had hepatitis C, for example, and was infected with hepatitis C about 20 years prior, but was not having any side effects or problems based on the disease, which is pretty common for hepatitis C, which can stay dormant for decades. He wasn't aware of his infection until he was getting ready for back surgery, and the lab showed that he was positive for hepatitis C. He had a couple of decisions he had to make at that point. Did he want to start treatment for hepatitis C, knowing that treatment rates are pretty good with hepatitis C, but it's a lifelong treatment regimen, and it's a very strenuous and tough and a treatment regimen that is full of side effects, meaning generally the person cannot work based on the side effects of the medication maintenance. It's very similar to treatment for full-blown cases of AIDS. Or you kind of roll the dice. And since he wasn't having any negative quality of life issues and wasn't feeling any side effects from the disease, do you just wait until you start feeling side effects? Now, if you wait until side effects or symptoms start coming up, the likelihood of the medication that the client or patient takes, the success rates will be lower. So if you start before symptoms start showing up, success rates are higher. If you wait until symptoms start showing up, success rates are lower. So he had a choice to make. He was having no symptoms, but he knew if he starts having symptoms, likelihood will be less successful. And if he started treatment now with no symptoms, outcomes would be higher. Well, he chose to begin treatment prior to symptoms starting, which was a logical choice, as logical as the other choice of waiting until symptoms started, since he had been infected for over 20 years. Well, the moral of the story is that the side effects were just horrendous. Even though the medication was successful in lowering the hepatitis C blood counts, the side effects of fatigue, vomiting, other physical ailments, depression, and so forth, at that time was worse than the actual symptoms. And this is just an example of many of the challenges that our patients face. That, yes, drug X helps me feel less depressed, but it makes me feel different in this way. or this drug levels out my mood, yes, but I'm not happy or sad anymore. I just kind of exist. And these are really important issues that the clients experience and they need help with, that emotional and other type of family support to get them over the rough patches, because there are lots of rough patches. Medication is not, especially medication for severe mental and physical disabilities and issues, it's not a TV commercial. It's everything's not pretty, and everybody doesn't feel great at the end of the road. Some folks feel worse. Some feel much better. So we'll be talking about these intentional and unintentional side effects, what counselors should know about medication, and providing additional resources for the National Alliance of Mentally Ill. I enjoyed reading everybody's posts. Just because I don't respond to every single post does not mean that I'm not reading them. I do. And in the meantime, please let me know if you have any questions or concerns. Many of you might be having experiencing problems with watching these videos. I'm not sure why there's a bug in the Forsyth Tech system with Microsoft Explorer. Many students have problems viewing these videos with Microsoft Explorer. If you do, please download the free Chrome browser from Google. You can just Google Chrome, and it's a free browser, and it usually works much better within Blackboard. And honestly, throughout your general web browsing, it's much faster, much more secure, much more stable, and most students don't have any video problems after that. And in the meantime, please let me know if I can help. Take care.